and Calvo Enterprises. It is 8:46. We're going to hit the NMI with Tomas Maglotnia coming up in just a little bit, but he's the head of the Bureau of Budget Management and Research, Mr. Lester Carlson. Bring him on to the show here. Good morning, Lester.
Good morning, Chris. Good morning, Sabrina.
Hi, Lester. I wanted to talk about your the plan, the budget breakdown that was submitted to the Guam legislature for the $117.9 million in CARES Act funding, and how I guess it was put together. Was it based on input from government agencies on their needs and their expenditures in response to COVID?
Yes. Do you and Chris have a copy of the Coronavirus Relief Fund guidance memo from
the U.S. Treasury?
Yeah.
Yes, I can pull it up.
Right. What we did was we reached out to all the departments and agencies, including the autonomous agencies, GCC, UOG, and the Port Authority, everybody. And we attached the guidance, making it very clear that any expenditures that were not part of your budget and were due to the public health emergency brought upon by the pandemic may be eligible for some of this funding. And there's like 6 categories. So our budget is sequentially structured to run parallel with the guidance memo. So if you look at things under item number 1, which are eligible expenditures include but are not limited to payment for, and then number 1 is medical expenses, and there's a whole bunch of bullets there. Then number 2 is public health expenses. Then number 3 is payroll expenses. And number 4 is expenses of actions to facilitate compliance with COVID-19 related public health measures, such as, and there's a bunch of stuff there. Then number 5 is expenses associated with the provision of economic support in conjunction with COVID-19 public health emergency. And finally, number 6 is any other COVID-19 related expenses reasonably necessary to the function of government that satisfy the fund's eligibility criteria. So we made sure that people understood the onset of the public health emergency was when the governor issued her executive order 2020-03 on March 14th, which is a Saturday, so kind of really went into effect Monday, March 16th. And that they had to have expenses that were corona related that weren't part of their budget, and submit those to us. And we received some expenses. We made some adjustments to be in line. We tried to be in line with people who are looking at Zoom capabilities, and there was one agency that had a rather large number for Zoom capabilities. So we reduced that number in line with other agency requests for Zoom, so that you wouldn't see something that was glaring. And it's kind of funny because did you guys listen to the press conference yesterday? Yeah, so Patty Arroyo said, hey, what's this about a $895 laptop bag?
Yeah, I saw that.
And she was, I said, well, it's the utilization of the fund for the activity. I won't sign off on an $895 computer bag. And she was, but it was under BBMR. So yeah, what happened was
what had happened was
we forgot the S. So it's 10 computer bags to be, for the telework thing. We're actually doing that we're trying to do it from here. The agencies don't come into us anymore.
Right.
So they send their stuff electronically, but we don't have the capability to do that from home in an efficient manner. So we're gearing up for the new norm. And sorry, Larry, I didn't put the S.
Yeah. There was something else here under BBMR, Lester, that was, you got that?
No, I was looking at the Hagåtña Redevelopment, Restoration and Redevelopment Authority for iPads, laptops, hard drives, network, storage.
I wanted to ask...
and the library, Guam Public Library system on there. There's just a
Lester-
lot on agencies I hadn't even thought of, like Civil Service Commission
Right.
for smart TV. Like-
let me touch on the Civil Service Commission.
Okay.
Have you ever been to a civil service hearing?
Right. Yeah, of course.
Oh my God, it's like pulling 8 of my teeth. So you have several cases that are being heard, and they don't. I mean, it's a time-consuming effort. They're migrating into being able to do these things electronically. They don't have any capabilities. Same thing with HRRA. They're currently housed at GITA, and they avail themselves to the equipment and facilities at GITA, but they need to be able to be self-sufficient. And everybody really should be looking at being able to have this telework ability. And that's where you see a
Right.
lot of
And so when people look at this, Lester, and they're like, "Oh my God, 5 million in laptops or whatever, they flat screen TV," all of this is being purchased to. I mean, I'm assuming to do that telework, to do the Zoom, to do the social distancing. But is all this? I mean, I
Is
know.
this essential? That's what I'm wondering. Like the
Yeah.
Guam Public Library system, do we really need them up and functioning?
Well, the new norm is going to be,
Right.
that we first and foremost, I would love to see a renaissance into the use of the library. Okay,
Mhm.
I really, really would. I remember that was, when after school, if you wanted to hang out, there was a couple places to go meet other people that were, just out of school too, and one of the places was a library. And if you were going to go see somebody, a library was always a safe place to do it. It was like neutral ground.
Yeah, it was a hookup spot.
Yeah, but I wouldn't want my son going
Yeah.
to the library during these
Lester, what
times.
about this BBMR $11,432 office reconfiguration to accommodate COVID policies?
Oh, you're going to be proud when you see that. You're going to be happy. We cannot and should not, and this goes for everybody, not just government but private sector. We are minimizing contact with people. When we do open our doors, there will be a area in which a customer will come in, and there'll be a separation from our people and their people. There'll be a plexiglass window with trays outside, and the whole idea is to minimize social interaction and to try to prevent as much as possible people coming in and coughing all over our staff. So the configuration, you're going to see a lot of that everywhere. Everybody, I mean, look at Payless, you look at Benson, everybody's got some kind of barrier up to minimize the contagion and the transmission of it. So we're doing the same thing. I need to protect my people. On a normal basis, Chris and Sabrina, there's a lot of people dropping stuff off here, left and right. Sometimes, the messengers will be coming back like 3 times a day from public health.
Yeah.
Okay, public health, right? Who touched those documents, right? This is the new way of thinking. I don't know who touched what, and all of a sudden that stuff comes over here. So the migration to the increased use of electronic communication and working to satisfy agency needs is working on our end, but that means we have to come into the office.
Mm-hmm.
We'd like to be able to have that, God forbid, should things get, that second wave come in or something like that. It's like the story in the Bible where the ladies are waiting for the groom to come over, and they run out. The younger ones run out of oil, but the older ones save some oil. Well, I'd like to have some oil.
Mm-hmm. Right. Yeah, but I mean, what is your, I guess, reaction to people who may say, like, why are we buying and giving money to like the Hagåtña Redevelopment and Restoration Redevelopment Authority when perhaps it could go to agencies like more money being given to health and safety?
Right.
Well, number one, there's a criteria issue. Okay, so health and safety are very well taken care of. There's patrol cars, there's fire trucks,
It's on ambulance.
Yeah, I mean, so we are taking care of public safety. We are taking care of public health. We do need to never lose sight. I mean, when we open up, I don't want to look down and the future is right there in front of my feet. I want to have my head looking at the horizon. And HRRA, yes, it's a visionary type of agency, but they're supposed to be the vehicle from which our capital is master planned and redeveloped. And we shouldn't ever lose sight of maintaining that vision. Let's make the most of
But if it's such a visionary office, there's only what, 2 people working in there?
Yeah.
Maybe 4.
I mean, well, what's the stop? I mean, if I'm in a government agency and I'm just as a hypothetical, and I see, wow, we can get a bunch of laptops, we can get some TVs, we can get, it's all covered with the federal funds. Let's go. What's to stop people from just buying all kinds of laptops, buying all, because it kind of looks like, I mean, I'm not saying that's what's being done, and I understand that we're making this move to telework, but who is it you, or are you the one who says, hey, wait a minute, that's not, no?
There's a bunch of stuff I cut out, primarily because it didn't meet the criteria.
Right.
So what is presented is what it was that we thought was appropriate. There are several agencies that are quote-unquote not essential, so they're not reporting to work, but that doesn't mean that they shouldn't have the capabilities to telework. So, just because somebody is a non-essential, an employee of a non-essential agency doesn't mean that, we shouldn't lean on them for something and be able to communicate with them effectively to be able to continue to, move forward.
What about so this report, this is going to be something that you guys routinely submit to the legislature?
Yeah, I think that recovery office portion, the repository collection stuff that I think Ricky Hernandez is going to be heading up. I think that's going to be, everything's going to funnel through for Ricky, and that'll be the vehicle for everybody to take a look at how things are done. And we will be very mindful of adherence to what it is that has been, again, it's a budget, it's a plan. When the details start coming in, we'll be very mindful of, making sure that people aren't wandering. And as the governor mentioned yesterday, if we see a need that we missed, and, nobody's perfect. I forgot the S, after all, and I got called out yesterday. So,
I better not see you with like a Gucci Louis Vuitton laptop bag.
Hey, you know what?
I mean, you don't really seem like the type, but I'll know. I know an $895 laptop bag when I see one.
Yeah, well, I wouldn't. So thanks.
Right.
We drink the same beer, so that's a good thing.
I wanted to ask about this Department of Administration $9.5 million credit card fees borne on the government of Guam as part of the team plan. The $3.5 million.
Yeah, I spoke about that actually twice yesterday. If you, Sabrina, are paying a bill, a government bill, and you wanted to use a credit card, you were lining up at, back in the day, right, over at RevTax, Treasurer Guam. You're renewing your vehicle registration, right? Say it was, it was $100, but you were to use your credit card, you were charged a convenience fee, and that convenience fee might have drove it to like $104, $105,
right?
But you had to eat the convenience fee. So understanding the economic impact on all of Guam, particularly the service industry, one of the very first things that we did was we said, okay, fine, we will eat the convenience fee. Well, let's allow people, because we're social distancing and we're asking people to stay home, to use their credit card, pay their bills electronically, not get in their car, not drive around, and we will eat that fee. So we estimate that cost to be $3.5 million. So what used to be borne on the customer and the taxpayer, we're picking up because we just thought that it was an appropriate thing to do. But it also continues, all of these things sequentially and collectively, are all designed to get us to be more electronic minded,
Right.
use technology.
Yeah.
And we're saving people a couple of dollars here and there.
Yeah.
Okay.
Lester, you know what's missing here is who you guys are buying the stuff from. So
But that's all going to be RFP.
Okay.
We're not going to like rush into stuff, and we're not. We'll get the bids and things of that nature. We have till December to spend the money, so there's no reason why we can't give the agencies the ability to provide the spending plan and request for the issuance of a requisition. Upon the approval of a requisition, it turns into a purchase order. It's given to the vendor, and then the vendor provides, and after the vendor provides, then the vendor gets paid. So, we'll be back to that situation.
Back to following procurement laws?
Yeah.
Oh, okay.
Hey,
I
Lester.
wanted I wanted to ask, so you have, I'm just going through the expenditures, COVID-related medical expenses, and there's $7 million for a American Medical Center, FHP, SDA, and the governor kind of touched on it yesterday about the Cures tier plan. So we don't know right now who's getting paid what, right?
No.
So how does that work? Because I noticed that Speaker Tina Bounier-Barnes earlier this week, she said that there was no MOU that was provided to these clinics from the governor's office, and they were still waiting. But from what I understood, an attorney turned in a MOU to the governor because they had been waiting.
Oh, I don't know.
Okay.
I haven't seen.
So how do you determine who gets paid what? It's just based on the cost that they incurred as serving as this.
I understand as much as you understand with respect to the need to have these facilities as part of the Cures approach to addressing the pandemic. The amount that is set there was there. When I am aware of the compensation breakdown and what the billings are going to be, then I can let you know. But I don't have that. I think the idea was that we know that we're going to be incurring a cost for the utilization of those 3 clinics, and that those 3 clinics are are due compensation. So
Okay.
If it's nominal, right? If it turns out to be nominal, like the question came up about GRMC.
Yeah. How is that going to work out?
Well, we're not paying them, but they're part of the whole network.
The Cures.
Yes, but the thing about it is, GRMC is providing services that ordinarily, because they're a private hospital, GMH would do. So they're helping with what's going on. And
Right.
if you've got insurance coverage, well, you normally wouldn't go there, but they're accepting, people over there. So they're charging. So, I mean, there's no need to pay them because if they're MIP or Medicaid, that's covered under that. If like me, under GovGuam with Aetna, if I presented myself there because GMH wasn't the place I was supposed to go to present myself because of how things are structured, then GRMC is providing part of the network for public health, and I mean they're not going to do it for free.
Right. Yeah.
So there may be some costs for GRMC as the non-COVID
There may be
hospital.
some additional income generated by us utilizing their facility
Right.
that they ordinarily wouldn't do. So think about it from that perspective.
No, I understand. What about this temporary hospital program for COVID-related expenses? $3 million. What is that?
So we put together like $7 million.
Right. So there's 3 million temporary hospital, 4 million quarantine facilities.
Yeah. So when we established the account, right, there in the account it says temporary hospital, but when you go to the exhibit that is attached to it, there's a more broad application. That was my catch-all for expenses for PPEs and for other requirements to stand up. There was money spent at Paseo. I authorized money to come from that $3 million account. It's like $35,000. I don't know if they used it all for the renovation of the
Safe
bathrooms.
Haven, which ended up not even I mean, they're not going to use Paseo anymore.
Well, we got renovated bathrooms. So
Right. Hey, Lester, there's a comment here from Ryan. He comments, I just renewed my vehicle online and still had to pay the credit card convenience fee. Can you ask Lester if I will be reimbursed?
Ask Ryan to send me the information. I will follow up with him. This program has been in place for a while.
Yeah.
There should not have been a fee assessed to him.
And so that's still in effect, right? Because I remember that at the start of COVID, the team, you guys said, hey, here's what we're doing.
Yep.
And so does that just kind of, does that $3.5 million, does that go to just whatever bank you guys, the people who with the credit cards bank with?
Yes.
Okay. Hey, and then Lester, I guess I had another question. Is this a budget or is it an expenditure report, or is both?
It's a budget, Chris and Sabrina, is a proposal.
Right.
When you look at
So has any of this money been already spent?
a little bit of it. There's
Okay.
the stuff that we incurred when we were using the catch-all $3 million account for PPEs and the Paseo renovation. We JV'd all of that stuff from general fund agencies that the governor exercised her transfer authority to actually have $4 million for quarantine facilities, $3 million for the catch-all, right, including the temporary hospital, and now we restored the allocations that we took from the general fund agencies last week, and now we're transferring all the expenses to this account.
What can you tell us about the disinfecting and the cleaning? Do you know what company that was?
Which company and what? I mean, there's a lot of
Right.
a lot of disinfecting and cleaning.
Yeah,
Everything is being disinfected, which is a good thing.
Yeah, I mean, there's a lot of cleaning that.
I'll get the specific. I'll shoot you a message later.
Okay,
Mhm.
yeah, no problem.
I did want to ask, I know we've been asking about this whole double pay issue, and it was brought to our attention that, autonomous agencies are paying, I'm not sure which ones, but we understand that some autonomous agencies are paying this double pay, but the line agencies aren't. And so I'm just kind of wondering, what's the difference?
That's an Edward Byrne question.
Okay. Edward Byrne.
Edward Byrne.
Yeah, if I had recalled that, I would have asked him that.
Right.
But just on its face, it doesn't seem like it would be fair.
GWA in particular was emailing myself and Mr. Byrne 2-3 times a week, and looking for guidance,
Mhm.
because they adopted more or less DOA's personnel rules and regulations. So that section on the double pay, it's there, and they were looking for guidance because they were trying to figure out, well, what are we going to do? And we hadn't issued the executive order, basically implementing the hazardous pay for government of Guam. We then did that, and we are guided now by the hazardous pay differential. What other people do who are outside of the governor's purview, autonomous agencies, the university, GCC, the courts, the legislature, we have no authority over what they do with the funding that they have. So if somebody's doing something different than the government of Guam, and they have the prerequisite authority to do so, and more importantly, they have the funding to do it, then we just can't afford it.
Right.
I'll just be straight up. You're right. It's not fair. I can understand that completely from a Budweiser drinker standpoint, but at the end of the day, it's like, well, you can do that, but I'm not going to advocate or endorse. As a matter of fact, I will oppose it. The differential hazardous pay, we can handle that, and it is an allowable expense under the coronavirus relief fund.
Hey, what do you think of this comment here we had, Lester? Why can't civil service and other agencies like HRRA take their computers and their TVs out of their regular budget and save the CARES money for essential emergency needs?
Okay, so Chris, you're doing me a really good favor because you're giving me these easy questions. The criteria for use of this money is that it could not have been in your budget. And that these costs were outside of your budget.
Right.
Yeah. So there wasn't anything budgeted in these agencies to be able to do this transitional, move. Hence, we thought it was an eligible expense.
Got it.
So they could, when you say transitional moves, you mean to teleworking?
Yes, I'm not an alarmist. Okay, the governor is always being careful to tell everybody that hey, heads up. They're talking about a second wave. I'm coronaed out. I'll tell you this. I'm glad I drink Bud because I'm coronaed out. I'm seriously, I am. And the thing about it is, I saw something and I don't read this much because it just kind of like, you read something and like, oh crap, and it's like there's a strain of the coronavirus now that is more dominant and more infectious. I mean, I don't want to hear this stuff, but it's out there, and the governor's being extremely careful. And I understand that like beaches got open in California and Florida, and then next the infection rate went up, so they closed the beaches again. So it's like we tried, but everybody started like going out there and interacting and forgetting about being responsible. So we just need to stay the course and try to understand that we're probably going to be using this as a great learning opportunity for how we get things done. But more importantly, let's not lose sight of where we want to be. Not I just got off my butt and I'm happy to stand. I want to walk, and then I want to run after that.
Yeah, and I get that. I think maybe because if we are going to move toward this teleworking and we're preparing for what may or may not be a surge in the fall, I just didn't see HRA as one of those priorities. Maybe like Parks and Recs getting funding, or Department of Land Management, or CLTC. I just figured those would be more of a priority than.
I mean, maybe they just figured that we can get these
or
laptops
the Guam library system,
and we can get these TVs, and it's covered. So, I mean, this is a working document, right, Lester? I'm pretty sure we're going to see. I'm just thinking all the agency heads now are like, "Oh, let's go get some laptops."
Right. Well, when you dropped this to the legislature, have any of them called and said, "Whoa"?
Well, what I did yesterday.
Whoa.
I was under the gun to get this thing done, and it was finally approved yesterday around 9:30. So Jason Baza from my office made some changes on the spreadsheet consistent with the governor's final directions, and then we had a cover letter developed, and then I had the governor sign it, and
boom.
I dropped it off directly to the speaker and to Joseph Augustine. So they got it maybe about 11, a little after 11 yesterday.
Right.
Mm-hmm. Have either of them called me to discuss anything? Not personally. They probably called. They might be communicating with the governor, but nobody's called me.
Okay, Lester, we got to run. We got Senator Shelton on the line, so want to get to her. But
hey, don't forget to wish her a happy belated birthday.
Yeah.
Right? Yeah. Okay.
Thank you. Go drink your Budweiser.
Yeah.
Have a great day.
Wash your hands.
After my bud.
Okay, fine.
Take care.
All right. 9:15. Yeah, let's get Senator Amanda Shelton on the line
He
here.
must have said that like 3 times.
Yeah.
I get it.
Oh, well, we are sponsored by Ambrose. So. Senator Shelton, happy belated birthday.
Hey, thank you very much, Chris.
Happy belated birthday.
Thanks, Bree. Thank you.